Warm welcome from Geneva, Switzerland. I'm Rida Sadki from the Geneva Learning Foundation. We're now 2 minutes and 10 seconds away from kicking off this partner briefing. Very much looking forward to this session. Very impressed that there were, as of yesterday morning, 105 organizations that were registered for this briefing, and I believe also a number of ministries of health. I'm just looking up the exact number. 16 ministries of health who had registered for this briefing. We're looking forward to telling you about Teach to Reach, this amazing platform, community, network of health workers. We'll explain what we mean when they say they are on the front line of climate change, all in 1 minute 34 seconds from now. Of course, some of you know, but not everyone knows Charlotte Mbou. She is a leader at the Geneva Learning Foundation, and she'll be hosting this partner briefing with me today. We're now 1 minute 20 seconds, and I can tell you that there is indeed quite a bit of excitement and enthusiasm already in the Teach to Reach network, this massive network reaching people all over the world who work for health and have in common the interest, the passion for learning from each other in order to improve how we work. Here we go. All right, and this partner briefing is starting in 20 seconds. We're also, if you have any problems in Zoom, you can also watch this on YouTube. 15 seconds. Here we go. All right, greetings from Geneva, Switzerland. I'm Rida Sadki from the Geneva Learning Foundation. I'm here with Charlotte Mbou, who is in Ebolova, Cameroon. How are you this morning, afternoon, evening, Charlotte?
Thanks, Rida, and hello, everyone. I'm doing great this afternoon, and as always, it's a pleasure to connect with you.
All right, wonderful. Let's get started. We have a lot to cover, and unlike a lot of the Geneva Learning Foundation events, which are focused on helping participants learn from each other, this is an information briefing for potential partners, and it is the first of a series. We'll be doing a repeat, as you can see, on the 11th of March, and then we'll have a monthly check-in for partners. But let's start at the beginning. Some of you may not know the Geneva Learning Foundation, and if that's the case, to keep it short and to the point, we're a Swiss nonprofit, and we're really researching new ways to learn and lead against the critical threats to our societies. Teach to Reach Connect is, as you know, approaching its 10th edition. It's been going since it started as a program launched in March 2020, and it's been quite an amazing journey. We'll be telling you about it in this briefing, of course. So it's a regular event, not necessarily always quarterly. Initially for immunization professionals, but now expanded to health professionals wherever and whoever they are, and who are interested in learning from each other in order to do better. Now, the point of this briefing is really to kick off the invitation for you as an interested organization, whether you are a National Ministry of Health team, a country, a regional partner, a global partner, or a civil society organization working at any level, including the local levels, to become a Teach to Reach partner. We've been quite, let's say, privileged and honored to have amongst our partners, anchor partners like Gavi or UNICEF. You can see a larger list of partners here. But what really amazed us for ahead of this briefing was to see over 105 organizations and 16 ministries of health. You can see a kind of rough list. This is unedited, so there may be some repeats, there may be some discrepancies here, but of all the organizations that expressed interest and registered for this partner briefing, quite a wide and really diverse range of organizations. We'd like to thank you for showing your interest. in Teach to Reach, where we have seen ascendant participation over the last 2 years, actually since now 3 years. As you can see, in March 2021, there's 2,604 participants, and it's just kept growing and growing. We'll tell you why and how. You can see also with people from many different parts of the system. Now, the health professionals who attend Teach to Reach, half work for government, half for civil society organizations, half are French speakers. And you can see some of the other characteristics on screen. Many work in remote rural areas or with the urban poor, support the needs of nomadic, migrant, IDPs, refugees, and 1 in 5 Teach to Reach participant faces armed conflict where they work. And we emphasize each time that it's not so much about the relationship that participants have with us at the Geneva Learning Foundation. It's actually about the relationships that people and the connections that participants make with each other. You can see on screen the social network analysis, the SNA, showing those maps. You have the two sort of separate parts because you have Francophone and Anglophone communities. Now, what do people say about, or global health leaders say about Teach to Reach? You can see a quote here. This is from Dr. Kate O'Brien and Ephraim Tilumango from WHO and UNICEF respectively, who say, uniquely, Teach to Reach provides a way to link health professionals together so that they can share experiences about what works. And then alongside Kate and Ephraim, we have Atta here, who works for Ministry of Health in Zamfara State, Nigeria. Charlotte is going to share with us what Atahir said about his experience of Teach to Reach.
Atahir says our collective experiences and passion can transcend borders and overcome even the most formidable public health challenges.
So, of course, the health impact for local communities on the front lines of climate change is at the top of the list. We began discussing it at Teach to Reach 9 and began the learning process, the learning to action process, and we're continuing that at Teach to Reach 10. Now, in July 2023, we came together, we shared a call to action with our community platform network, and 4,700 health professionals responded within 2 weeks. We asked you a simple question: is climate change a threat to the health of the communities that you serve? And overwhelmingly, you can see that most of you gave the highest or very high threat level to this particular threat. Now, the people again that participated, contributed, shared their observations are most often part of a family or trusted friend in the communities that they work, lending credibility to their observations, to your observations. So if your organization works on climate and health, well, why partner with Teach to Reach? This is an amazing opportunity, first of all, to show your support to health staff on the front line of climate and health. Second, there are tremendous opportunities to listen and learn about these issues, to engage with this community around these issues through plenary sessions, one-to-one networking, Teach to Reach questions, and so on. And then, of course, if your organization offers tools, opportunities, services, then Teach to Reach is a great platform to actually launch that and share that with people who attend Teach to Reach. In fact, I do want to mark a pause just to say hello to a couple of people. We won't have time to say hi to everyone. Before I tell you about neglected needs of women's health, just want to share back some folks on the YouTube for Sajal Data from India, who is connecting. So he said hello twice. Tell us if you've participated, and I know you have, in Teach to Reach before, what you would like to say to the potential partners. Why should they consider partnering with Teach to Reach? And then also Saidia Kashama from the Democratic Republic of Congo. So from the DRC all the way to India, you can see there's quite a wide span with so many countries participating. Now, we have had over several editions of Teach to Reach peer learning sessions on neglected needs of women's health, and we'll be continuing those at Teach to Reach 10, as well as, of course, a focus on immunization agenda 2030. As you know, in March 20, as you may know, actually, in March 2022, the Geneva Learning Foundation launched the Movement for Immunization Agenda 2030, calling on immunization staff to engage, to make a commitment to helping to achieve the goals of immunization agenda, which is a world strategy adopted by all member states at the World Health Assembly in 2020. So at Teach to Reach, we'll continue to hear from IA 2030 leaders and the newcomers, health workers who are just now joining this movement to achieve the immunization goals and ensure that every child is protected from vaccine-preventable diseases. Also at Teach to Reach 10 will be the Manifesto for Global Health. So this is an open source document manifesto to which over 1,300 health workers contributed, and will be sharing the latest updates. And this is really the running thread that connects all of these issues to each other. If you work at the local levels, all of the issues are interconnected, and it is obvious. It is less obvious if you work in a global health silo. Our aim is to help connect these different parts of the system so partners can support specific themes that they're especially interested in. They can also support cross-cutting sort of functions of Teach to Reach. So that's the first part of the update. I do want, if you are in our Zoom studio, remember that you have the Q&A that's available if you have questions. And of course, I see, so we invite you to raise your hand, keep your hand raised. Once I've run through the briefing, we'll tackle the questions. Do write out your questions or share them in the chat. As you can see, we can, of course, share. Yes, and thanks, Charlotte, is way ahead of me, has already shared this. Now, next up, we're at the 8-minute mark. So going to tell you what happens before, during, and after Teach to Reach. People tend to think of the event and it's 2 days, 20th and 21st of June. But actually the most important, the most significant learning and change happens before and after through a set of activities that I'm going to briefly tell you about now. So first of all, before Teach to Reach, we have the sharing of experience, which is organized for Teach to Reach 10. For the first time, it's going to be organized week by week. You can see here the shared experiences from Teach to Reach 9. Let me get myself out of the way. So our Insights unit collates all of the experiences that are shared around the different themes of Teach to Reach. And you can see here, for example, that on the question of zero-dose children, you had 184 contributions in English and 118 in French. And contributions can be can be quite detailed, people telling us about their experiences.
Can you remove the chat? Sorry, Reda, can you remove the chat window from the screen?
Oh, yes. Okay, thanks. Thanks. Sorry about that. All right. So you can see here the sample description for these shared experiences with, in some cases, dozens or hundreds of contributions from health workers on the ground. Now, what these shared experiences provide is really deep insights. And you can see here, to get a sense of what, I'll post this link. You can also get the slide deck. I think I'm going to, if Charlotte hasn't yet shared the slides, I'll do that now. And you can have, this is basically the raw materials, the raw outputs, which we then condense down into insights reports and lessons, listening and learning reports, as we call them. Now, in the coming weeks, we'll be launching the Teach to Reach questions. I believe it's on the 8th of April, but we also have a set of activities that may be of interest to partners, and Teach to Reach partners will be invited to also, optionally, if you choose to, partner for these activities. And this is, I'm especially excited to tell you about. First of all, what's happening this week is the International Women's Day events and activities, of course, all over the world, many organizations. Our contribution has been to ask our network and community and platform 2 questions about their experience as health professionals and women. And you can see here, for example, Dr. Faiza Rabbani, a public health specialist from Pakistan, who says, "Empowered women empower women." Her story is published across our social media, and we invite you and encourage you to look at these stories, to take the time to read them, consider them, and think about the power of this type of sharing of experience, sharing of very specific insights, and what it means to have thousands of women contributing in this way their experiences. On this question of gender, it is very central to Teach to Reach. You'll be hearing from women who deliver vaccines, a self-organized collective of women who work in vaccination from the facility level all the way to the central teams, to the central national teams, as well as already mentioned, neglected needs of women's health. Now, the next activity is actually something we've never done before, and I want to open up by showing you this beautiful photo taken by a photographer, Chris DeBode. Chris is our first fellow of photography. We're honored to be working with him, and he's actually ecstatic about engaging with health workers who are participating in Teach to Reach in order to share his knowledge and share his experience actually in helping health workers document their own stories, their daily work, their daily challenges, their daily also successes and lessons learned. And so he's going to be leading a workshop with healthcare workers from 44 countries. I believe, I forget the exact number of people who have signed up. I think it's close to, it's around 300. And these are contributors who contributed in the past to the international photo exhibitions of the Movement for Immunization Agenda 2030. This time, Chris is particularly keen to expand and encourage health professionals to also document what they're seeing change in terms of climate change impacts and health. And you can see here the countries that participants for this workshop are coming from. Now, I mentioned Teach to Reach questions, and this is really central to the peer learning experience. In the run-up to Teach to Reach, registrants are invited to share their experiences. And of course, we work with partners to define these Teach to Reach questions. We work first and foremost with the community, but we also consult with partners that express interest in asking specific questions and also help us make sense of what we get back in terms of experiences that are shared on the ground. So that's all before Teach to Reach. And now I want to tell you about what happens at Teach to Reach. Again, this is a very different type of briefing from what the peer learning in which Charlotte and I would be speaking as little as possible and really giving you the space to share. Our purpose here is really to give potential partners, the information that you need to make a decision. Does this fit? Is this something that is of interest to you as an organization? So, of course, there is, during the event itself, so this is 20th and 21st of June, there is a conference and networking platform, the core of which is actually these one-to-one networking sessions. So you press on the button and you're connected with another health worker or maybe one of the partners, and you can have a one-to-one private conversation. We suggest the themes, but of course, people are free to share their experience and have a professional discussion on issues that matter to them. What we do is afterwards, we document what is learned by asking questions after the event. Now, recognizing the challenge of connectivity, most of the significant learning happens what we call asynchronously. That's a jargon of education. It just means that you don't need to be connected in order to learn. One of the ways in which we do that is by offering an audio-only podcast, which is low bandwidth and perfect if you have limited connectivity for most things. But of course, to actually benefit from the live networking where you're just making that human connection, you do need to have sufficient connectivity. So what happens after Teach to Reach? Here is where you share your learning insights and reflections. And here is where the Geneva Learning Foundation's Knowledge to Action Hub comes into play. So this is a system for really supporting knowledge translation, the application of what is learned, and also tracking and documenting how, if someone shares a story at Teach to Reach, actually being able to determine down the line that this story has helped someone make a difference. That is core to the system. It is not an add-on. It is not something where we try to figure out afterwards how to do it. It's been part of really this from the beginning. So just checking to see if there are, and I encourage participants to use the Q&A if you have questions at this stage. How can your organization become a Teach to Reach partner? So first of all, the first decision you'll have to make is whether you are a partner or a sponsor. So Teach to Reach is open to all, especially local organizations. We'll invite partners, and once you receive the invitation, you complete a questionnaire, and from that point on, you share your logo, confirm that you are in a position to actually share this and make the commitment for your organization, and then the opportunity is really to engage with Teach to Reach participants in your own workshop space within the Teach to Reach space. So just to give you a quick sneak preview, you'll receive this invitation, and so this is my own invitation. Will you attend Teach to Reach, yes or no? So if I say yes, and you can choose whether you want to receive other invitations and collaborations. So of course, I'll put in my own organization's name, but you should put in yours. Now, this right now is a limited list of organizations. We're actually expanding this list as we're expanding Teach to Reach partnerships. And so you could just click through here and you'll be asked questions about the various options of how you want to partner. If you want to host a workshop at Teach to Reach, if so, you'll be asked to describe what's in the workshop and so on. Now, the second option is, of course, is to help fund the next Teach to Reach. And this is really how we've kept Teach to Reach going since 2020. So there are 3 tiers of paid sponsorship. But again, you do not need to be a sponsor in order to participate, contribute, or benefit from Teach to Reach. So the opportunity for global partners is really to connect with health professionals, to listen, to engage, to have that really immediate your direct engagement with people who are on the front line of climate and health and many other issues, to engage in that meaningful dialogue and to support women and men on the front line of service planning and delivery. Now, if you're the leader of a local organization, in this case, we believe that there are many different ways in which Teach to Reach can be helpful to you, but it's again that opportunity to meet, network, and learn, and also to really showcase your organization to other Teach to Reach participants, including global partners through the workshop option. So the best way to, we will be working to amplify really the stories, the experiences shared. And we'll be doing this primarily through social media. Like it or not, this is the main way we can share. And if you'd like to already see what is coming out of Teach to Reach 10 already, you can just follow any of the links that I've just shared in the chat. Now, a couple of things. If you do decide to host a workshop at Teach to Reach, and assuming your proposal is accepted, again, you have some of the options that have worked well for other partners include a listening session, a presentation, or a more interactive dialogue. Now, one thing to note that we'd like to say right away is really the workshops run concurrently with networking and plenary sessions. There will be, as you can see, there's a massive number of people involved with Teach to Reach in various ways. We cannot predict how many people will come to your workshop. We will work with partners to promote and amplify through our own social media and through the social media of larger partners to do that. Now, I realize I'm running a little bit behind, but I don't see, I see 2 questions on the Q&A. So we want to share 2 case studies. And welcome to, so Özden Gökdemir has used the Q&A to say hi. So hello back. Again, we encourage you to use the Q&A to ask your questions. So I'll go now into the case studies, and then we'll use the remaining minutes. We wanted to keep it short. We're trying to be respectful of your time to share just 2 case studies of how global partners have used the Teach to Reach platform, network, and community, really, and also served the needs of that community. But as a preamble, this is from Violaine Mitchell. She's the director of immunization at the Bill and Melinda Gates Foundation, and this is actually at the Teach to Reach in January 2021, the very first one. Her perspective, she believed that TGLF is actually setting the pace for how we do things in the future. So case study number 1 was with UNICEF. We worked with Deepa Pokurel and Ibrahim Dadari and the team at UNICEF on identifying and reaching zero-dose children. So we asked participants to share a success story, a lesson learned, or a challenge, and again received dozens of detailed context-specific answers across a range of 7 Teach to Reach questions. And we knew that we were asking the right people because within the large, very massive group of Teach to Reach participants, we knew that the IA 2030 members, almost half of them, work with the urban poor. So to give you an example of a teach to reach question, and again, we work with partners to define these questions, to really refine them, to make sure they connect their sort of experiential questions that will elicit the right response. You can see an example of a very specific set of questions that make up a teach to reach question. So Dr. Ephraim Lumango, Chief of Immunization, this was his feedback. We've said we want to listen, co-creation is important. This is exactly the type of innovative approach that we need to overcome the complex challenges we're faced with in global health. The second case study was with Dr. Folake Olayinka. So this was as chair of the IA 2030, so Immunization Agenda 2030 Working Group. And again, these are immunization-specific examples, but there's no reason in the world why, with respect to climate and health or other issues such as neglected needs of women's health, that these case studies do not apply. So this was her feedback. We went through this more extended process beyond a single teach to reach question or set of questions, really, as I'm going to explain in the next slide. But she said really, that it was insightful, actual experiences, opportunities, challenges, and enablers. Now, she's also the immunization lead at USAID, but this was in her capacity as the chair of the working group. So what we did with the working group was working with almost 5,000 members of the community. We shared a framework for action that had been developed by the working group and put it to the test. So we asked you for feedback. We asked the community for feedback. And 30 and 90 days after, we asked, well, okay, so you have this new framework. What have you done with it? How has it been used to make a difference? How could it be improved? And we got many different kinds of answers, actually 5 different kinds of answers. Many people said, I've been too busy, sorry, or said it's a great framework, but didn't share anything specific. But we also got a significant number of credible, specific narratives of actual use and examples of how to improve it. So that's the second case study, and I hope it helps make tangible what may seem is actually a complex sort of system with many moving parts, but it comes down to what you as a partner would like to accomplish if it involves listening and learning to what happens to communities at the local levels, what happens to communities on the front line who are bearing the brunt of the effects of the impacts of climate change on health, for example, or who are on the front line of trying to reach children who have not been vaccinated. So this is the sort of, if that is part of what your organization is trying to do, then we're very interested in exploring how to partner for Teach to Reach with you. So I'll start with the questions in the Q&A and then ask Charlotte if there are people with hands raised. And I know some of you have been waiting for a while, so we appreciate your patience. We did want to get through this information. So how can we be part of the partners that are implementing zero-dose activities in our states and country? So you may meet some of those partners at Teach to Reach, but we suggest you work through your local health authorities, UNICEF, CDC, AFINET, and Global Fund. They're likely to be at Teach to Reach. Thank you, Rabiu Abdelwahab, for that question. Charlotte, over to you. Who shall we hear from for the first comment or question from partners?
I'm inviting Mariam Radi. I see Rabiu has their hand raised. You already answered his question, their question. I don't know if they have something else to add, but there's Mariam Radi. I've invited to unmute. Mariam, are you able to unmute yourself? And I just wanted to recognize the comment from Melese Teferi in the chat, a long time scholar and Teach to Reach participant. Mariam, I'm inviting you to unmute. Your hand has been raised for quite a while.
All right.
Okay, over to you, Mariam, and please do introduce yourself. Tell us who you are, where you're connecting from. I see Reda Mariam is unmuted, but
we're not able to hear you. Mariam, can you check your audio connection? Maybe reach out. Let me see if we can reach out to her in the chat. All right. And if there are other partners with questions, unless this briefing has been so clear and that there are no questions. There's various ways to interpret that, but I hope. All right, Mariam is once again muted.
Has connectivity issues.
Okay. All right. Audio seems not to work. Mariam, if you could ask your question or comment in the chat, that would be wonderful. All right. Okay. So we've got 4 minutes remaining. If you have questions in the meantime, while you think about formulating the questions, if you are interested in supporting Teach to Reach and contributing and benefiting from Teach to Reach in various ways, there's this very simple thing that I'm going to ask you to do right now. And I'm going to post what looks like a bizarre kind of link. It's very long, but if you click on it, I'm going to show you what happens. I'm going to just, let me see here. Yep. So I'm going to click on this link, and what you'll see is it will ask you if you want to open up WhatsApp. And what it does is, all right, this is actually a Teach to Reach 9 invitation. Let me see if we can fix that. I think, yeah, let me see if we can post a corrected link here. And we're keeping an eye on the Q&A as well as the chat, or for any raised hands. But here is the corrected link. If you click on that, let me actually test it. Yes, okay. So that's for Teach to Reach. Okay, we'll share a corrected link. But anyway, the point is, one of the things you can do right now is just share Teach to Reach with your networks. Okay, it looks like there are no further questions from partners. There's an impressive number of participants in the room. We were remarkably impressed by seeing that within a very short time, with very short notice, we had 105 organizations and 16 ministries of health that registered for this briefing. Will be doing a repeat and also sharing the recording and resources. This huge, massive slide deck, I should warn you, for this partner briefing. And again, we'll be organizing a monthly, essentially a monthly coordination check-in. The only exception is we'll be doing a repeat on the 11th of March, including a briefing in French and maybe at some point in the near future in Spanish as well. And then really you'll receive the link to actually complete this questionnaire, which I shared, which I give you. I just walked through the first few screens where we ask you if you'd like to join as a partner, starting with will you attend Teach to Reach 10. So look for that on your email, and then we'll also be sharing additional resources and information for you to confirm your Teach to Reach partnership. And for organizations interested in sponsorship, we'll be sharing those options as well very soon. So should be coming your way this week. So I think that is it. Thank you so much for having joined this partner briefing. We hope you found it useful. Again, it's very different from what we usually do with experience sharing, but we wanted to keep it short and to the point. Make sure you leave with the information that you have. If you have any further questions, do follow up by email with Charlotte or myself. You should have our emails by now. And let us know if you have any other feedback that can help us do better for you as a partner and really support you in that engagement with this massive community that really could benefit from the support of partners. The more partners, the more opportunities we're able to share through Teach to Reach, the better. Once again, thank you and goodbye.